What if the wagging tail you fear most could become neutral, just like background noise? I'm Dr. Colin DeLinde, clinical psychologist and CBT therapist, and today we're going to dive into a very common fear, dog phobia or cynophobia. This is one of the top animal phobias I see in my practice, and the good news is you can overcome it. And today I'm going to show you how, using Cognitive Behaviour Therapy or CBT. When someone has dog phobia, there's typically a specific incident that triggers this. So it could have been the person was bitten or somebody close to them was bitten. And even if it was just a scrape, the brain will still encode the experience as dogs are dangerous. The problem is that the brain doesn't store the context. So it doesn't think about, or it doesn't store why the dog did this. Did it get a fright? Did you try to take away its toy or its food, or did it think you might? Or was it just the dog being badly behaved? So any of these could have been factors, but they don't get stored along with the emotional content of dogs are dangerous. So phobias forms through a process called associative learning or classical conditioning, where a frightening experience gets paired with an object, in this case the dog. And this happens in the primitive brain, whose main job is to keep you safe. And this part of the brain doesn't do logic or reasoning or gray. It's very black or white, threat or safe. Also, if something is similar to a threat or an item that is already on the threat list, the brain will err on the side of caution, and this item will make it onto the threat list. So, for example, if you were bitten or you observed somebody being bitten or heard about it by, let's say, a Rottweiler, after a while you get scared of any kind of Rottweiler, a Doberman, a big poodle, because it's a similar size and color, maybe a similar shape, could be a greyhound, and eventually even little dogs. So you can see how these maybes keep making it onto the threat list. And eventually, every time you think about a dog or see a dog, your body reacts as if you are in danger, even when the situation's safe. So as a result, we get avoidance. You feel temporary relief, but the fear becomes more deeply wired over time, and your world becomes more complicated. You have to avoid certain places, you have to avoid certain friends' homes because they have dogs, or you can only visit if the dogs are locked away. Can't go to parks, many places in public you can't go to. And what sometimes happens is you've avoided dogs, but then you have a child and they love dogs. So they go towards when everything in you is saying run. So this is often when people present at the practice. Other times it's when a partner has a dog and you have to try and desensitize yourself to this if you want the relationship. So how does CBT help? Step 1 is to do a careful history and what we call a behavioral analysis. So basically, we're looking for the exact components of the phobia. Is it all dogs or specific breeds or sizes? Can you manage a puppy, or are even those too scary? Does the length of the hair matter? We also explore exactly where the fear started. Did something happen to you? Did you see it? Did you hear about it? And what are the beliefs that you developed after that? Step 2 is where we explore your core beliefs, not only about dogs, but also about danger, control, and vulnerability. For example, you might be thinking any dog could bite at any time, or if a dog growls, it's definitely going to bite. I wouldn't survive another bite. People won't understand that I'm this scared and I can't trust them, that they'll really lock the dogs away or control them. Maybe you think small dogs are sneaky, big dogs are aggressive. Or you might think, if I encounter a dog, I'll freeze and I won't be able to speak or move or get away or call for help. So we would identify all of these beliefs, and then we would challenge the beliefs and assumptions and we would ask clarifying questions. For example, what's the actual likelihood that a dog will bite you if you walk past a dog? Will a dog cross the road to come and bite you? How many dogs have you passed in your life without something bad happening? And if this incident happened as an adult, you probably had many years of where dogs were absolutely fine. If you were young, maybe you don't remember, but certainly by the time someone comes to the practice, we can ask these questions. You've encountered many dogs by then. And then we can also ask questions like, if you are anxious and you feel like you're frozen, can you in fact still move or breathe or speak? And then together we start to build more balanced alternative thoughts. For example, not all dogs are dangerous. Some dogs are trained, calm, friendly. Or maybe a belief around anxiety is uncomfortable, but it's not dangerous. And something like, I can walk past a dog and still be okay. And then each of these thoughts will be tested and strengthened during the exposure work. And here the aim is to see the exaggeration in the fear thoughts, and more importantly, a capacity to cope. Step 3 is called psychoeducation, and it's an additional preparation for the exposure part, which comes right after this. So you do the psychoeducation as part of questioning the beliefs, or otherwise just after. And in this section, we look at dog language. How well do you know what different positions of the ears or the tail or the body mean? Do you think that all growls or barks mean that a dog is about to bite or attack? Do you know how to approach a dog or when you shouldn't? And this is where we can call in an animal behaviorist, or we can use videos, or we can actually use a therapy dog to illustrate. What now happens is the actual exposure. Now, before the exposure, we often teach relaxation techniques like breathing or grounding yourself. For example, feel the ground under your feet, feel the clothes on the body, so you can actually make yourself feel safe, because of course you're going to be having some anxiety. We also plan self-talk coping statements like, I can feel anxious and still be safe, or this is my conditioned fear response, not a real threat. Something like that is very helpful just to repeat, almost like a mantra. And before we do the actual exposure, we spend a lot of time on creating the exposure hierarchy. And this is called a graded exposure hierarchy. So we start small and then we gradually build up. And we do this together so there can be no misunderstandings and no surprises. And going into a small, deliberate exposure and building on capacity is what we're really aiming for. So an example of a graded exposure hierarchy for dog phobia could start with looking at a picture of a calm dog, watching a video of a dog walking or being petted, and this would be a calm dog. Then you could pair this with holding a plush toy so you can watch and get the sensory input. For some people, having the toy there would be where it would start, and then coming closer, and then eventually being able to do this. So you're getting the sensory of the feeling, and then you're watching the video. And then what you would do would perhaps watch a video, which I'll play for you in a few moments, on dogs being excited and barking, and see if you can decipher the dog language from the sound or from the way that they look. When you've done all of that, you may then start to observe dogs at a distance, like in a park, but maybe in your car or outside the fence. And that could be with a therapist there, or it could be with a safe person who's been trained. And you would again discuss the dog language. You would then maybe walk past a leash dog, stand near a calm dog, and eventually be able to touch the friendly dog, the trained dog, maybe on a leash and then off the leash with the owner present. And this is unique to the person. If you look at this little dog, this is a toy. It looks very soft and cuddly. It is actually very soft, But if you look at its mouth, some people see the mouth as looking fierce. So again, it would depend on where the phobia sits. Some people might be more worried about the size or the breed, or what are the ears doing, or is it jumping, is it barking? Others will be looking at the face. And if this is too much for someone, we can even start with something like this, which is technically a dog, but clearly non-threatening. And this is where trained therapy dogs are incredibly helpful. They're at the session with the therapist, so you can gauge where the client is at any time, with no risk of something becoming too much. And what's interesting is that in this context, often clients can push further than they thought they could. So I'm now going to introduce you to my therapy dogs, Emmy and Akira. Emmy's very floppy, and it's very hard to be scared of a dog that looks like an Ewok or Sid from Ice Age. And she's actually a very empathic little creature who seems to sense when someone's in distress. She tends then to go very still, and she'll just make eye contact, or she will allow somebody to touch her if she's lying on my lap, her back, or first her tail, because sometimes that's all that people can do. So this is Emmy. She's a Yorkie of some sort, and as you can see, she is awfully floppy, like Sid from Ice Age, furry, like an Ewok, and very lovable. So it would be very difficult for somebody to become scared of such a floppy little creature. And she's the kind of dog where if I'm holding her or she's lying on me, she will allow somebody to touch her from the back, which many dogs won't let you, or even to stroke her like this. So this is often where I begin with my dog phobics. She's very non-threatening. And then they graduate to the other dog, Akira. This is Akira, and he's actually much more bouncy. He's got little Yoda ears that are very expressive, and he gets very excited when there's a cat around. He's also very cute, as you can see. So he's much bouncier under normal circumstances, especially when he meets someone new. At the moment, he's being held by me. But I'm going to see if I can get him to move his ears. Akira, Akira, do you see the cat? Do you see the cat? Now he's looking out of the window, and you can see the ears are perked up. He is also a little dog that loves tummy tickles. So as you can see, because I'm handling the dogs, and you can see they're very well trained, very comfortable, very cute, very non-threatening, it's a form of deconditioning, vicarious learning. So people see me handling the dogs, see the dogs responding, listening, even if they were jumping up and down, and I said sit or something like that, they would see them responding to that. They'd be on a leash anyway, so they couldn't get too close to the person if they didn't want them there. But before the client meets the actual dogs in the therapy room, the client will have seen a video of them in the dog language section, where the two of them are playing a game which involves play growls and excited barks. I show it with the sound off, then with just the sound, and clients are usually surprised how differently they interpreted what they saw when the sound was paired with the visuals of the dogs playing. And remembering that the dogs will be on a leash as far from the client as they need to be, and then the client will approach whichever part of the dog they feel comfortable to touch. And this keeps the dog calm, and it shows them that the dog is safe to be touched and eventually be stroked and, who knows, even played with. So this process is tailored to each person. And I always remind my clients during exposure that each step will feel uncomfortable, but not overwhelming. And that's the key. So after around 8 sessions, most people can be in the presence of a dog, especially if it's a smallish dog or if it's well behaved, potentially on a leash. And this will happen if they engage and they do all the steps. And sometimes it's more than overcoming the fear. It actually expands where people can go without having to be vigilant for a possible dog in the area. And sometimes they even become dog owners, believe it or not. So if you're living with a phobia, please know that it's not silly or just in your head. It's learnt, and it can be unlearned. CBT is there to take you through this every step of the way. Please like, subscribe, and share this with anyone who could benefit. And thank you for watching.